The coronavirus infection rate is soaring across the Southeast, Texas, and Southern California this morning. There were more than 73,000 new reported infections in the country on Friday. It's pushing the total number of cases in the U.S. above 4.1 million and the death toll to more than 145,000. It comes as the Centers for Disease Control and Prevention issues revised guidance for schools to reopen and signals support for in-person learning. Michael George is here in New York with more. Michael, good morning.
Dana, good morning. Health officials say the virus is spreading faster right now than at any point since the crisis began. And now parents are facing a difficult decision, whether or not it's safe to send their children back to school.
Back to school will require more than back to basics as plans to reopen classrooms go forward.
Students are not allowed to share any kind of materials in the classroom.
An Indiana nonprofit providing free school supplies is tallying up requests like never before.
We're talking hand sanitizer, Lysol wipes, masks, all these extra things that you have to just disinfect your classroom and keep yourself, your family, and your students safe.
The Centers for Disease Control greenlit school openings this week, stressing the importance of in-person instruction, but encouraging social distancing and keeping the same teachers and students together in groups called pods to contain possible outbreaks. But language like teach and reinforce use of cloth face coverings, written in May, are now labeled recommendations, and it doesn't detail when an outbreak should trigger a shutdown.
Let's not turn your public school into the next big germ factory.
The National Education Association is among those calling for caution. Dr. Anthony Fauci was asked Friday about what the science tells us about how the virus could impact children in schools.
I think we need to start off with a little humility and say, we don't know all the answers to that right now.
This week alone, surging cases in Florida filled ICU beds to capacity at least 50 hospitals, where the numbers, now more than 400,000 infected, continue to rise. But Florida's governor is still holding back on widespread restrictions.
In terms of the business restrictions, we're not going to restrict the business. I think if you look at the spread, it's not really deriving from business as much as it's deriving from home outbreaks and then family and friends.
Yet in places where the virus has been successfully knocked back, more restrictions were imposed this week.
Every traveler coming to Massachusetts, no matter where they're from, has a responsibility to help keep COVID-19 out of the Commonwealth.
Violating visitors who don't quarantine for 14 days will be slapped with a $500 fine. The nation's patchwork of policies applies to face masks, too. Social media posts show confusion over masks.
I'm not paying for masks!
Even confrontation over them. McDonald's and several other well-known companies now say they will require masks inside stores.
And it's because the nation's mask rules are so inconsistent that some governors are calling for a federal mask mandate. Some health experts have said that the U.S. could drastically reduce the virus in just a few weeks if we committed to lockdowns and wearing masks. It's a lesson learned here in New York, which in April was the global epicenter of the virus and now has one of the lowest infection rates in the country. Jeff?
All right, Michael, thank you very much.